And that's the reason why. So the only time I can tell you that that exists in humans, the reason I got really interested in this story, when I was a young resident, this is when endoscopes first came out. I had the opportunity to do a third ventriculostomy in an in-utero baby. Why? The OBGYN found out that the baby had hydrocephalus, and these new endoscopes where you can make a small little hole like that and pop it through the uterus, and then go to the baby's head. We make a small little incision right next to where the coronal suture would be. We go down through the germinal matrix of the frontal lobe, and we get into a place where something's called the lamina terminalis, which I think you know is the anterior wall of the third ventricle. And right below that is something called the basilar artery. There's a membrane there in a fetus that's really, really thin, and you can see light through it. And when we do this surgery, we shine the light, look, and see the basilar artery through it. We put a little hook through there and pull it, open it up, and that allows the CSF to go from inside the ventricles to in the subarachnoid space, and you take everything out, and that's it. Here's the interesting part of that case. You know, when that baby's born, I got to see that baby. Do you know that baby didn't have a scar anywhere from the surgery I did? Do you know that?
No.
It's the same story as Becker. So guess what? Turns out the blastema and a fetus, what do they share in common? They're using all these paramagnetic atoms for wound healing and regeneration. It's the same story that Becker found in the salamanders and the frogs. And then what did Becker do in his own work? He said, well, I know that in utero surgery is talked about being done. Is it possible that I could regenerate in a mammal completely, bone, skin, muscles, and nerve? So he took a 9-year-old whose finger was amputated to this level here. So you can see that's the first phalange.
Yeah.
So it's down to here. And he altered his technique. He published this in 1972 in a 9-year-old using the techniques that I'm telling you about here through hypoxemia and nitric oxide. He de-differentiated the cells and was able to regenerate the finger completely.
So the fact that certain organisms, like certain amphibians, are famous for being able to regenerate limbs, it's not some intrinsic difference between us and them. It has to do with the oxygen environment enabling this de-differentiation to happen.